Distinguished guests on the dais, off the dais, and the most important, the chief guest, the students, and the future leaders. When I'm standing here and I'm thinking of, how lucky you are, because you have Dr. Leslie Mancuso, who is the leader in nursing. And then you have Mr. Dileep Kumar, Dr. Dileep Kumar, who is the visionary in nursing. So you have two people who are in this room, and they are talking to you, they are telling you what you can do, Think big. Don't think, I'm now just doing nursing and what can. You have the whole world to conquer. And this is the time that I feel as Jphiego, Country Director India, very fortunate that we have come together. SGTU University, we have INC, Indian Nursing Council, we have Ladal Foundation and Jphiego. And when 4 strong groups come together, what happens? A tsunami, isn't it? And what I was just telling Dr. Teja that SGT University is going to be the epicenter of this tsunami for the nursing education in the country, and not just in the country. Our vision is going to be for the world.
You are fortunate to become a nurse. You have opted to be a nurse, and we are also going to work with the ICN, because in ICN there is a platform for the nursing students. There is a separate platform for the nursing students. We are going to interact with the ICN. Board is going to be there. I am going to take up this issue so that how Indian chapter of the nursing students can be created, so that there will be an opportunity for the Indian nursing students to attend the World Health Assembly, because that is the World Health Assembly which is the highest in the globally, where all the health ministers of the 190 countries, all the health secretaries of the 190 countries, all the DGs of the 190 countries will be attending religiously every year to discuss the global health scenario. The global health trends are discussed in that. So such an opportunity is going to be created to the Indian nursing students shortly.
So very warm good morning to all, and a huge welcome to all the dignitaries on the dais and off the dais. We are honored to have Dr. Leslie Mancuso with us today on this platform. Dr. Mancuso is the President and CEO of Jphiego since 2002. By profession, Dr. Leslie is a nurse. She received her undergraduate degree in nursing from Southern Connecticut University and an MA degree in nursing from the University of Pennsylvania School of Nursing. She went on to pursue a doctoral degree in education and organizational leadership from the University of Pennsylvania and an executive leadership certificate from the John F. Kennedy School of Government. That is a government school at Harvard University. Dr. Leslie is a recognized international business leader also, with a track record of success in bringing accountability to and navigating changes in the international non-profit sector. She has over 25 years of experience in developing public and private partnership.
The house is open to you all now. This is, as everybody's told you, this is a great opportunity for you to interact, to know how did Dr. Mancuso reach this level of leadership. What were the steps that were most important? What are some of the experiences that she feels will be very beneficial to you? So we'll be ready to take questions.
My name is Rhythm and I am from BSc Nursing 3rd year. Ma'am, I just want to ask you, what challenges did you face to reach up to this position, being a president of Jphiego?
I think that's a really good question, because people assume oh, she got these degrees and therefore she became the president and CEO of Jphiego. That's not really the case. As you can see, I'm a woman. I'm a nurse, and very proudly a nurse first and the president and CEO second. That's how I see myself. When I came into the world, when I was working in the nonprofit sector, I was teaching at, let's start back. I worked as a nurse in neonatal ICUs and pediatric ICUs. Then when I got in more advanced degrees, while I was doing that, I was still working night shift in ICUs. When I got my master's degree, continued working night shift in ICUs. Then went on the faculty at the University of Penn. Then went to nonprofits. And what I learned when I got to this first nonprofit, not Jphiego, was that historically they had never had a woman in a leadership position. They had never had a nurse in a leadership position. And so it wasn't that easy in the beginning. It was a matter of me making sure people knew that as a nurse, I knew healthcare better than anyone. I mean, nurses right now in our world make up more than 50% of all the healthcare workforce are nurses. We have a lot of power. We just need to use that power. And so it was really important for me to show my leadership skills, to show my decision-making skills, to learn the business. I decided if I wanted to be a leader, I needed to learn all about the business of the nonprofit world. I needed to learn finance. I needed to learn fundraising. I needed to learn how to do programming. And so I moved up in that nonprofit into positions that typically had never been held by a woman and by a nurse. Then Jphiego recruited me, the organization that I'm at now, and I'm so thankful they recruited me. For 30 years, Jphiego was led by a physician and by men. And so it was certainly very different for them to think, we're gonna stretch. And at the time, interestingly enough, most NGOs that were working in women's health were led by men and were led by physicians. Now that's not to say that there were excellent leaders in these other groups. That's not to say excellent. But I felt that it was my responsibility to show them that a nurse could easily lead an international nonprofit and should be because of our knowledge of healthcare. And so, obviously I got recruited and obviously I took over. And in the beginning, there were certainly challenges. And when you take over any new organization, people saying, ooh, she didn't come from inside, she's a nurse, all those. But you see, you have to believe every step of the way that as a nurse, we are very strong. We have a lot of experience. We know our clients. We know our communities. We're as close as anyone could be to the communities that we live in. Because really, oftentimes, it's the nurse that most communities see first and foremost in every country. And so I had to distill in everyone when I came to Jphiego that I actually understood healthcare and understood what we needed to do as far as leading an organization. And I had the background because I learned how to lead, I understood finance, I understood all the different areas of the business. So remember, I never use the word just in front of a nurse. I never say just nurse. I wanted to be a nurse. I'm proud of being a nurse. I did not want to be any other profession. And I believe that no matter what you do in healthcare, you are still always a nurse first. That's why you're able to get different positions. And so constantly think of yourself as I am a nurse and I am proud. What other questions do you have? That was a great question. I just talked and talked.
Hello ma'am, I'm Aarti. I'm working as a faculty in Faculty of Nursing at SGTU University. Thank you so much. Ma'am, actually, whenever we are trying to, bring little change into the society, society, okay, and we are trying to take some initiative regarding our profession. Obviously, there are certain kind of barriers, whether it is professional barriers, societal barriers, or any kind of personal barriers we are facing. So I just wanted to know about what could be the continuous force, or what were the continuous force behind your journey, who is providing you the continuous source of motivation, so that we can be boost up, we can boost ourselves to take that particular initiative. So what were the continuous motivational force behind your whole journey, ma'am?
Well, you know, I think that's a good question. People always assumed I knew what I wanted to do. That's one question I hear all the time. Oh, so you always knew you wanted to be a president and CEO? I said, no. So you always knew you wanted to teach nursing? No. These opportunities came and I worked my way to figuring out what I really loved. You know, it started in graduate school and I started realizing, you know, I actually find teaching interesting. But it wasn't something I planned 10 years earlier. It was something that I learned that I enjoyed. I did not know I was going to like administration. But it was something that, over time, as I began leading, it was important for me because I felt comfortable. But the one thing I will say to you is we can't stay closed within our little bubble. And so it's not that we as nurses can only learn from nurses. I learned from many people. I learned from my physician colleagues. I learned from my public health colleagues. I learned from business. Right now, I'm on a number of boards that are business boards. Why? Because I learned something from them that's something I perhaps wouldn't get any other way. So in fact, I have a board meeting I was telling T.Dileep in Thailand tomorrow morning. So I'll be on that call. It's with all international companies. But I purposely want to stay on that board because I learned different things about what the private sector is doing, about how they look at management. I'm leading one of their committees, and I'm the only nonprofit leader on that board. But I think it's important for you all to remember, we must learn from all different disciplines. Even though I sit here and say to you, nursing is powerful, we are powerful, I am proud to be a nurse, we must remember we are part of an entire discipline and community, and we must learn from our colleagues, and we must teach them as well. It's not about them just teaching us. I teach them. I teach those companies just as much as I learn from them. Because the more I feel I can sit on boards like that and educate them about nursing, about healthcare, about what's going on in the nonprofit world, the better it will be for our world. So it goes both ways. But certainly that motivation is something you have to find what you love in your career. But you also must stay open to opportunities because you don't need to be boxed in. If an opportunity came, like opportunities came for me, people said, do you want to teach? And I thought, oh, okay. I didn't plan on it, and then I loved it. And so take those opportunities. Don't be so fixated in what you're going to do, but know that nursing can bring you down many different avenues. And that's a great thing. But learn from others and learn from each other. Thank you.
My name is Nisha, and I want to ask you that what are the importance of research? Actually, we are a student of basic nursing 3rd year, so we study research. So what are the importance of research in nursing?
Oh, absolutely. That's great. In fact, I just came from the academy. So in nursing, just so you know, T.Dileep and Bulbul know, there's an academy of nursing. And, you know, it's a challenging process to get into it. But its focus is about the scholarship of nursing. And it's about nursing leadership and where we should go. And that was a big discussion item. She's asking about research. I was just at the Sim Lab, and before I say anything, let me just say, SGT University is on the map. That is something I cannot believe. I wanted to stay and learn. I wanted to stay and practice. It is truly extraordinary. But one of the things I said to the faculty the time, I met with some faculty that were there, and I said to them, here's an opportunity for you. We need to talk about how simulation and using that simulation makes a difference and makes an impact on the world we serve. So I encourage them to collect data, to collect the evidence on how is this helping us help students to acclimate easier and thus make it so that you are helping patients in a much easier way and saving lives in a better way. So I suggested to them that it's an important piece of that simulation lab is that we collect the evidence behind why it's important and therefore publish on why it's important, and then encourage our colleagues in the rest of India and beyond to do the same thing. So research is about evidence. And you know, we can't be talking about what we're doing as nurses, about what we're doing in healthcare, about universal coverage and all the things that are going on in our world unless we're talking about evidence, an evidence-based, a research base behind what we do. Everything you do as practicing nurses had a research base to it. It had evidence that tells us why we do this as nursing. And so nurses, we must have nursing research. We must have evidence as to how things are done differently. You're going to graduate at a time that the world is looking at universal health coverage, that the world is looking at SDGs. And you're going to need to be telling the world how we do that, and what are the best ways to do that, and what systems you've used to do that. And the only way we can do that is by having research behind it, by having that scientific basis behind what we do. So nursing research is critical. I know when you students hear it, your eyes glass over and you go, oh, nursing research. But it actually is the fabric of why you're able to do what you do, because somebody did the research to prove that those things you do are the right things to save your patients' lives, or to prevent disease in your patients. So if not nursing doing research, why should somebody else do research on what we do? We should be doing it on what we do, and more importantly, we should be doing it very interprofessionally. Nurses need to be part of interprofessional research teams. It's really critical nowadays that nurses feel that they should be talking to their colleagues in public health, talking to their colleagues in medicine, and looking at research in a collaborative way, not just as nursing research.
Thank you, ma'am.
Thank you.
Hi, myself Shivani Sharma. I'm a student of BSc Nursing 3rd year. I want to ask, according to you, what qualities should we as a student nurses possess in ourselves to become a good leader, a good nurse?
Understand yourself, meaning understand who you are. You don't have to have the same personality as me, because I'm crazy, right? No. You have to be who you are, but you also have to be confident in who you are. You see, if you're not confident in who you are, and confident in your own knowledge and your own skills, you can't be a leader. So it starts first with your confidence and your belief in yourself and your commitment to your knowledge and your skills. And then from there, it goes for the qualities of how do you influence change? How do you influence people's opinions? How do you influence that client that they need to do something that will prevent diabetes? It starts there. Think about the skills you get as a nurse. People always ask me, why do I think nurses make good CEOs? And I say to them, because think about all the skills we get in nursing school. We're taught to look at a person, not touch them, to look at a person and analyze what we see, right? Not even going near them, just looking at. We're told to take everything in. We're told to listen to everything that person says. We're told to analyze their environment, right? To analyze who comes with them, how the interchange is. We're taught to to figure out how we encourage that client to do things that perhaps they haven't done before. Think about a leader. I have to walk in to different situations, and I have to quickly analyze what's going on. In fact, sometimes my team said, how did you know? Like, how did you pick up on that? And I said, well, I saw the person's face, and then this other person looked at that person, and then they started to whisper, and I assumed that's what was going on. So there's something to be said about what we got in nursing and how that translates to leadership. So I say, number one, use those skills you've got in nursing and translate that into leadership. There is no doubt behind leadership is also knowledge and skills, and getting yourself broad and understanding the different aspects of what you're trying to lead. You know, you have to do homework, you have to understand the situation. I am constantly learning every day still. I sat with Bulbul last night and listened to everything going on and understood what was happening and tried to figure out. I learned from her. Hopefully she learned from me. That's all part of being a good leader. It's obviously being strong-willed and being bold, but there are different types of leaderships. There's different ways of going about being a leader. But it starts with that whole taking all the skills you have, adding to those skills what you need, and making sure that you have that ability to manage and move up into being a leader. Thanks.
Can you tell them what is entrepreneurship in nursing, according to you?
Whoa, I think that's a loaded question. Well, let me just tell you, because you probably don't know this, but I won the Ernst & Young. Have you ever heard of Ernst & Young? I won the Ernst & Young Entrepreneur of the Year Award for the East Coast about 5 years ago. And that's not right. I was telling you that because here I was, nurse first, president and CEO, and I was competing against all these business leaders, again. And they asked me questions about how did I take the organization from 5 million to 400 million? How did we grow from 4 programs to 200 programs? More importantly, how did we move an organization that was centered in the United States and move it almost totally into the countries in the region? Because we're in 45 countries around the world. And so it was all about exploring the theme of being an entrepreneur, taking risks. Leaders have to take risks. Entrepreneurs live for risk because they're all about taking ideas and looking at whether to take that risk. Now, the beauty I have as an entrepreneur is I have people like Bulbul. I have people last night, she was just saying to me, Leslie, I think in India, these couple areas are new areas we need to be working in because I'm seeing the data, I'm seeing the gaps, I think this is where Jphiego should be. And so I, as a leader and as an entrepreneur, sit there and go, you know what, let's take that risk. Let's invest in that risk. Let's figure out how to do it, and let's do it. And so an entrepreneur has to be willing. Now again, you don't always succeed. As an entrepreneur, you don't always succeed. And that's part of the risk-taking of an entrepreneur. Because you're taking a new idea on and you're saying, will this work? And then you're trying to see, and you're bringing the best people you can bring behind it. You're getting the experts, you're getting the finance people, you're getting the HR people, everybody's in it. But you have to know that sometimes it doesn't work. But that's part of being an entrepreneur. And I accept that some risks I take aren't going to succeed. But if some of them do, that's all the better. So I'll give you an example. So I have a lot of examples, but probably the one that was the newest one is during the Ebola crisis. we worked in Liberia and Guinea, and everyone was running into those countries and setting up clinics. And so I asked our staff in those countries, what do you need? And so it was mostly nurses and midwives who said, we don't need you to come in, we don't need people to come in and set up any more clinics. But what we do have a problem with is that health workers are dying because of their protective outfits that they're wearing. And what the nurses and midwives in these countries, these are nurses and midwives in Guinea and Liberia that said, we think they're dying when they take their garments off. Because it's so hot, they have to take them off every 2 hours. We think there's a problem. So they came to me and said, what should we do? And again, I wasn't the leader of this. I have this incredible person named Kashyap, who's our medical director, Harshat Sangvi, many people in India know him, who really spearheaded this. The risk I took was, Leslie, we need money. We have an idea. We want to do a hackathon in our university with all students over a 3-day weekend that want to come. And we want to create a new protective, there's a name, suit, or, protective garment that'll work. So over a 3-day period, using Jphiego funds, nursing school, public health, engineering, we have a group that does all this with space and Mars. Those engineers came. We had a dressmaker come from the community. And they then ended up creating a new garment. And I'll speed it forward to say, they broke out into groups. One group won. We submitted grants for it, though we won those. We created a garment, and DuPont is now using that whole garment as a prototype for a new garment they're going to come out with. That's thinking like an entrepreneur. That's saying, and here's what the nurses were right about. It took 21 steps with the current protective outfit to take it off. We have it down to 7. And so it was really the nurses and the midwives that came up with that idea. But it was, where do you take your risks? Do I put money into this? Do I not? It seemed to me that was a good thing to put money into.
My name is Harsha from BSc Nursing 4th year. So my question is, what are the qualities of a leader?
Well, qualities of a leader. I think I went through a lot of them.
Qualities, or you can say role of a leader.
Number one, I feel like I always have to have a vision that looks out 5 and 10 years. And I think that's really important. I don't look at just now. So we might be doing something now, and my question to my team is, what's out 5 to 10 years? So that's why I was saying to all of you, you're coming out soon. A leader is thinking about, okay, what needs to happen for the patients I'm caring for 5 or 10? What are new innovations? What's new ways of doing things that we need to be able to do? So a leader looks very strategic. A leader thinks strategically. They think years out. They think about how you can help bring people together behind your ideas. You see, a leader is about how do you engage people, your own staff, your colleagues, and bring them forward with them thinking it's their idea and they're moving with that idea. Part of leadership is helping your team, your staff, guiding them, but allowing them the freedom to use all the skills they have. So it's not a micromanagement, it's a guidance, and it's a helping them use the best skills they have to achieve what you think is best for the organization. So wherever you go, that's an important piece, is understanding the mission of where you're going, the focus, and thinking ahead of what else could be done that would help this clientele, the communities, whoever you're serving, do things better. And again, it does take confidence, it takes risks, it takes learning. A leader always needs to keep learning because you can't know everything. I'm very clear. I don't know everything there is to know about maternal child health. I know some things, but I have experts like Bulbul, and I have experts in my countries who know their countries way better than I'll ever know. So I have to, as a leader, trust them to understand their environments, to understand the needs of their country, and then guide them and allow them to be the leaders. They say, I learned from my mentor many years ago. Her name was Claire Fagan. She was the dean at Penn and then became the chancellor at the University of Penn. And she says the best leaders build leaders around them. And so I've always felt that my job is to help Bulbul and all my leaders around the world become the best leaders they can be, because that makes our organization stronger.
Thank you, ma'am. Thank you so much. Thank you so much, ma'am, for this wonderful and knowledgeable session.